In this video, I'm gonna talk about what kind of questions should you ask when your baby is staying in the hospital after birth with diagnosis of neonatal abstinence syndrome. It's always good to be informed about issues so you can be better parent for your child while he or she is staying in the hospital. As a reminder, I'm Dr. Wiśniewski on my YouTube channel Neopet Edu, and the only purpose for this channel is talk about issues affecting premature babies, full-term newborns, and infants up to 1 year of age. Before we get to actual topic for today, let me remind you what is the definition of neonatal abstinence syndrome. Neonatal abstinence syndrome, or in short NAS, it's a condition that occurs in newborn babies due to their mother's exposure or consumption of opioid substances. Those opioid substances could have been prescribed by the doctor, or mothers were taking them as illicit drugs. As a consequence, fetus and baby becomes dependent on those substances, and after birth, baby may present with withdrawal symptoms. Due to that fact, a lot of newborn babies have to stay in the hospital for a little bit longer than otherwise it would be a case for a full-term baby, and sometimes it actually for a very long time if they need to be treated medically. Question number 1. Who is in charge of providing care for my baby? In American hospitals, there are a lot of professionals who provide care for their patients. And you will see nurses, you will see medical students, residents, those are doctors in training, fellows, those are doctors in subspecialty training. Then for pediatric patients such as newborns, there might be a pediatrician or neonatologist providing care. And those doctors, they may utilize so-called mid-level providers to help them, such as physician assistants or neonatal nurse practitioners. Also, if your baby has some additional problems on top of their neonatal abstinence syndrome, there might be a cardiologist or neurologist or surgeon taking care of your baby. So always ask that question, who is in charge? Question number 2. What kind of medical problems my baby has? That's a question you always want to ask because you should not assume that your baby is in the hospital only because of neonatal abstinence syndrome. We know that mothers who suffer from addiction or are treated for addiction are at higher risk to have complications during pregnancy, and also their babies may have additional complications. So sometimes babies with neonatal abstinence syndrome have other problems that need to be addressed in the hospital. So you want to know about all diagnoses and all medical problems that your baby has. Question number 3. You want to ask whether hospital where your baby is staying has enough experience, enough resources and personnel to take care of your baby. Neonatal abstinence syndrome is a very complex diagnosis, and evaluation and treatment of this condition has been evolving over last several years. Question number 4. What kind of methods are you going to utilize in order to evaluate my baby's withdrawal symptoms? You want to know those methods and techniques because it will help you also to learn better how to participate in care of your baby. Question number 5. Is my baby already having any kind of withdrawal symptoms? As a parent, you want to know exactly what's going on with your baby at any time. And if you decide to stay with your baby for a prolonged time after birth, by knowing what kind of withdrawal symptoms baby has and how to help your baby during that difficult time, you will be able to participate better in its care. Question number 6. You want to ask how you can help your baby. What your baby's doctor is recommending, that what you do for your baby. Each institution, each hospital may have a little bit different ways of taking care of babies with neonatal abstinence syndrome. So it's always wise to ask your nurse, your doctor, what they recommend you to do for your baby. Question number 7. You want to ask whether hospital is able to provide you with the room for you and your baby. We know from literature and different reports that babies who are staying with their mothers during the time while they were going through withdrawal symptoms they had to stay in the hospital for much shorter time than babies who did not stay with their mothers. Question number 8. Can I provide breast milk for my baby, or can I breastfeed? As I said in my previous video as well, we know that mothers who provide breast milk to their babies are able to help their babies so much that those babies stay in the hospital for much shorter time than babies who are not receiving breast milk. Question number 9. You want to know how they are going to treat your baby for symptoms of neonatal abstinence syndrome. It is very important that the main emphasis is on non-pharmacological measures and on providing your baby with the ideal environment without additional noises, lights, and disturbances. And also it would be ideal if they provide you a separate room so you can stay with your baby alone and try to console your baby as much as it is possible. The old studies, as I already mentioned before, showed that this environment is the best. Question number 10. You want to know whether you can talk to social worker and explain your situation and make sure that you will be able to take your baby home. As we discussed in my previous videos, sometimes hospitals are obligated to notify social worker and social services about each baby with neonatal abstinence syndrome to make sure that they investigate your personal situation and make sure that you will be able to take your baby home. Also, they will make sure that you have appropriate home environment for your baby and you have enough resources. So it's always a good idea to be proactive about this situation and seek out help from social worker that works for the hospital. So that concludes 10 questions that you should ask when your baby is in the hospital with diagnosis of neonatal abstinence syndrome. If you like this video and you are interested in other issues affecting premature babies, full-term newborns, and infants up to 1 year of age, please subscribe to this channel. And if you have any questions regarding this condition or some other conditions affecting newborn babies, please let me know down below under comment section.